This medication is used to relieve severe pain. Morphine belongs to a class of drugs known as opioid analgesics. It works in the brain to change how your body feels and responds to pain. It is important to follow the dosage and timing recommended by your healthcare provider for the best results. This medication can be given by injection into a vein, a muscle, or under the skin. It is important to use this product exactly as directed by your doctor and to follow the manufacturer's instructions for preparation and use. If you have any questions about how to use this medication, consult your doctor or pharmacist. Morphine may also be given by a doctor as an injection around the spinal cord or into the space that contains the spinal cord. If your doctor directs you to continue using this medication at home, it is usually given as a continuous injection using an infusion pump placed under your skin. The dosage of morphine is based on your medical condition and response to treatment. It is important to not increase your dose, use the medication more often, or use it for a longer time than prescribed. Pain medications work best if they are used when the first signs of pain occur. Before using, check the product for particles or discoloration. Before injecting each dose, clean the injection site with rubbing alcohol. If this medication is given into a muscle or under the skin, it is important to change the location of the injection site with each dose. Consult your pharmacist for more details on how to store and discard needles and medical supplies safely. If nausea occurs, consult your doctor or pharmacist for ways to decrease it. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. This medication may sometimes cause addiction, so it is important to use it exactly as prescribed to lower the risk of addiction. Tell your doctor if your pain does not get better or if it gets worse. Some common side effects of morphine sulfate 0.9% Nacl plastic bag injection may include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, increased sweating, or dry mouth. You may also experience pain, redness, or swelling at the injection site if the medication is given into a muscle or under the skin. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise, and you may need to take a laxative as well. To lower your risk of dizziness and lightheadedness, it is advised to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, you should tell your doctor right away if you experience any serious side effects such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, vision changes, slow/fast heartbeat, severe stomach/abdominal pain, or signs of your adrenal glands not working well. In the case of very serious side effects like slow/shallow breathing, fainting, severe drowsiness/difficulty waking up, or seizures, it is important to seek medical help right away. A serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to get medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed, it is recommended to contact your doctor or pharmacist. If you experience any side effects, you may report them to the FDA in the US or to Health Canada in Canada. Morphine sulfate 0.9% Nacl plastic bag injection should only be used as prescribed by your doctor, as it carries a risk for abuse and addiction. It may also cause severe breathing problems, especially when starting the medication or after a dose increase. It's important to use the smallest effective dose for the shortest possible time to lower the risk of these serious side effects. If you are prescribed this medication, it's important to discuss with your doctor or pharmacist whether you should have naloxone available to treat opioid overdose. It's also crucial to educate your family members about the signs of an opioid overdose and how to treat it. Additionally, it's important to keep this medication in a safe place to prevent theft, misuse, or abuse. If someone accidentally uses or swallows this drug, seek medical help immediately. For women of childbearing age, it's important to discuss the risks and benefits of using this medication with your doctor. If you are pregnant or planning to become pregnant, let your doctor know. Using this medication during pregnancy may slightly increase the risk of birth defects, especially if used during the first 2 months of pregnancy. It may also harm the unborn baby if used for a long time or in high doses near the expected delivery date. If you notice any symptoms of withdrawal in your newborn baby, such as crying that doesn't stop, shallow breathing, irritability, shaking, vomiting, or poor feeding, seek medical help right away. Before using this medication, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any medical conditions you may be dealing with. This includes brain and breathing disorders, gallbladder, kidney, liver, or stomach/intestinal issues, pancreatitis, difficulty urinating, and any history of substance use disorder. It's also important to be aware that this medication can make you dizzy or drowsy, so it's best to avoid alcohol or marijuana while taking it. You should also avoid driving or using machinery until you know how this medication affects you. If you're an older adult, you may be more sensitive to the side effects of this drug, so it's important to be cautious. If you're pregnant or breastfeeding, it's crucial to discuss the risks and benefits of this medication with your doctor to ensure the safety of both you and your baby. It's important to be aware of potential drug interactions with morphine sulfate 0.9% Nacl plastic bag injection, as they could impact how the medication works and increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. Some products that may interact with this drug include certain pain medications, naltrexone, and samidorphan. Using this medication with other products that cause drowsiness or breathing problems can also increase the risk of serious side effects. It's important to inform your doctor or pharmacist if you are taking other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, be cautious with other medicines that can cause drowsiness, such as allergy or cough and cold products. Always check the labels and ask your pharmacist about using these products safely while on morphine sulfate 0.9% Nacl plastic bag injection. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this drug. If someone has overdosed and is experiencing serious symptoms like passing out or difficulty breathing, it is important to give them naloxone if available and then call 911. If the person is awake and not showing any symptoms, it is necessary to call a poison control center immediately. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, severe drowsiness, and coma. It is important to seek help immediately in these situations. It is important not to share this medication with others as it is against the law. This medication has been prescribed specifically for your current condition, so it should not be used for any other condition unless instructed to do so by your doctor. In that case, a different medication may be necessary. If you are using this medication on a regular schedule and you miss a dose, use it as soon as you remember. If it is near the time of your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double the dose to catch up. It's important to store morphine sulfate 0.9% Nacl plastic bag injection at room temperature and away from light. Different brands or packaging may have different storage requirements, so make sure to read the package labeling or ask your pharmacist for specific instructions. Keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.